the tools that optometrists have are obviously lenses. And so we can use lenses not just for correcting sight. There are ways of using lenses to reduce eye strain, reduce headaches, reduce those kind of symptoms. For people who are whose binocular visual dysfunction is related to other hypersensitivities around flicker and light and movement and those sorts of things, sometimes tints become a useful thing to help them cope with those sort of symptoms. We may occasionally use prisms as part in our lens prescribing. Vision therapy is one that we go to because lenses can't treat everything. And so it's a combination of rehabilitation, but also desensitizing. So if you've got someone who's got binocular dysfunction where they're getting the dizziness and the vertigo, so part of our vision therapy is trying to desensitize them to the triggers that create that dizziness and vertigo. And then the other part of what we're doing in vision therapy is actually improving the function of binocular vision and its relationship to focusing. And then there's just counseling around good hygiene habits. And so, trying to use a bigger screen further away, taking regular breaks, what distance are you holding the book, what sort of lighting, what sort of posture. So there's a lot of that visual habit sort of counseling that forms part of it as well, particularly in the maybe the early stages where, we're starting to see signs of it. The symptoms aren't too bad. They're not quite prepared to maybe wear some glasses at this particular stage. And so the habit counseling goes across, regardless of whether you're needing treatment or not. It's good advice to try and avoid some of these issues as well.
With regards to tints, so if I understand this correctly, like everyone's vision is individual. So it's like some tints might help some people, but a different tint might help a different person. Is that right?
Yeah, and you'll get people where the tint makes no difference. You'll get some people where it's a very specific tint seems to create the greatest relief for them. And there's another group where just any tint provides some relief. And so that's just where it gets quite individual. So, I'll often say to patients, there are some people where just a light grey tint is enough just to take the edge off things. And there's others where it needs to be of a specific wavelength or colour for them to feel like they're getting relief.
Smack me down if I'm incorrect in saying this, but I sort of get the impression from hearing you talk about prisms that you're not, or maybe you're a bit ambivalent about the whole idea of prisms in lenses. Do you want to talk about that?
Well, and look, I'm certainly ambivalent about the way tints are prescribed as well. So, that people need to be careful that prisms and tints can become a bit of a cure-all. And so, if all you've got a hammer, everything looks like a nail. And so I tend to take the approach that my preference is to use the simplest device possible. So if I have to start using prisms or tints, then that's a more complex lens than what you might need. Now, there might be some situations where we've got no choice, that is the best thing for you, but it's not something I necessarily rush into. Some of the challenges with prism is you're actually sometimes treating a symptom rather than the cause, where there are other ways to prescribe that try to get to the cause of the stress on the visual system. And some people may redevelop the problem through the prism. And so you get this thing called eating prism. Some people will say that doesn't occur, but I've certainly seen it happen often enough that it certainly makes me cautious around the prescribing of it. I don't see people sort of needing tints tend to be a little bit more stable. You've got to be careful with tints because the effectiveness of them may be different under different light sources. So what works under a fluoro may not work so well in the incandescent lighting or outdoors. So I think there's just a little bit of care that needs to be taken into prescribing them. And like I said, if I can give someone the opportunity of developing better vision without having to use, these additional things on a lens, then that's my preferred approach. But not everyone can commit to vision therapy. And that's part of the discussion. It's why we leave so much time, because we want to talk through all these different pathways of this is what you could do, this is what you could do, and these are the kind of outcomes that we might expect from it.
So this is something that I'm a little bit unclear about. So I think I understand what tints are and how prism lenses work, and I can understand that adjusting lifestyles that could work, but I don't really quite understand vision therapy and what that is. Can you sort of like go a little bit deeper on that for me?
Yeah, I mean, at a simple level, people think of it as an eye exercise, but we're not exercising muscles. We're providing an environment where people can pay attention to where they are in space relative So where their body's in space relative to other things, how do they change the way they look at something to make it easier and more comfortable? So, we like to call it OT or physiotherapy for the eye. So you're developing more awareness of how you use your visual system, and then you're practicing more efficient ways of getting the two eyes to work together, more efficient ways of focusing. So it's not something that you have to concentrate on. It becomes more and more automatic. And then we also want to develop what we call generalization, where you're now able to use those new skills while doing other things. So you don't have to concentrate on. So basically, it's activities designed for you, first of all, to become aware of how you're currently using your eyes, then developing better, more efficient ways of using your eyes, and then repeating those until that becomes the new way you see.
So can you give me like some practical example of that? I mean, are we talking here about like the good old pencil push-ups, or is there something that something else that you might give people to do as an exercise to improve their visual
Yeah, and if we have a
coordination?
look at where pencil push-ups came from, is that you can see someone has the inability to track, and the eyes stop looking at it, and pencil push-ups is trying to force the two eyes work together. Whereas if we look at the loss of convergence you have when you're doing this, it's either because it's painful to do, or you've lost the awareness of where it is in space. And so we will do activities with some things that generate 3D targets, and ask people to get a real sense of where in space these 3D targets are. We might be using feedback mechanisms where they can actually get some feedback on where their eyes are pointing, so they really get a sense of being able to change and control that. Whereas this tends to be just kind of forcing the two pens together. So it's a lot of the activities of making sure you're paying attention to what you're looking at, but also things in space around it. So in the office, we use a lot of things where it might be a red and blue glasses or Polaroid glasses to produce this sense of 3D, so that we're kind of amplifying your understanding of how your two eyes are working together. And then that provides lots of feedback for then working on it. We might be using lenses that change how you focus. And so you get a sense and a feel of how you make that lens clear or blurry. And so we're using these tools so you become aware of trying to change how you're seeing and getting some feedback that way. And because it's a different path for each person, because it's not just a matter of moving muscles around, it's really learning to understand what your vision's doing. It's really like, I call it personalized coaching for the visual system. It's a one-on-one thing that you do with the therapist, is the ideal environment to be successful, and that you're doing it regularly enough that it becomes a new habit.
So I'm assuming that there are some like exercises that people can do at home on a regular basis to do all this.
Yes. So we do in our practice, we do a 45-minute vision therapy session. So you're working with the therapist doing what we call office-based activities. So there's things where we're using equipment in the office to, like I said, generate these 3D images, or to allow you to kind of move and see what's happening to your visual system at the same time. And then we'll send them home with some sort of more basic exercises to kind of reinforce the things that you're learning to do, things where you're shifting your focus, or getting the two eyes to work together. And so you have that sort of 15, 20 minutes of home practice to kind of make it stick.